So today we're going to be talking about oscillopsia, and opsia means see, and oscillate means to move around a reference point. And so oscillopsia can be vertical, or it can be horizontal, or it can be torsional. If the oscillopsia is associated with a sign, the sign is usually nystagmus. So if the eye is jumping, your world will be jumping, and that world jumping is what the patient sees. So the symptom is oscillopsia, but the sign is usually nystagmus. And depending whether it's upbeat or downbeat, or horizontal, or rotary nystagmus, that's the direction that and speed and amplitude that the patient's oscillopsia will be. If it's nystagmus, it's usually going to be bilateral. However, there are some monocular causes of oscillopsia. And the main monocular oscillopsia that you need to know about that's in one eye only is superior oblique myokymia. So in superior oblique myokymia, because the superior oblique muscle's primary action is intorsion, they'll get oscillopsia, but only in the affected eye. So they often describe it as a small amplitude, high frequency fluttering or flickering of the image. This is a monocular oscillopsia, superior oblique myokymia. There are also people that have oscillopsia with no eye movement. So that could be either organic or non-organic. In the non-organic, they're just making it up, of course, but that could still be conversion disorder or somatic symptom disorder or malingering. So you have to think about those things in the DSM-5. And if it's organic oscillopsia without a concomitant sign, that can still be cortical. So the where pathway and the what pathway are the association cortex areas that can tell our brains what we're looking at. And so some people have illusory sensations of motion even though their eye isn't actually jumping. The other illusory sense of motion that you have to think about in oscillopsia is when it's the vestibular ocular reflex. Those patients often has oscillopsia, but their problem is peripheral nystagmus. So you need to be thinking about nystagmus or nystagmoid movements in patients who have the symptom of oscillopsia.